The quarterly review meeting of the State Task Force Committee on Immunization and Primary Healthcare Health System Strengthening looks at successes recorded within the period under review and challenges as well as proposed solutions to forge ahead. The Deputy Chief of Staff to the Governor, who oversees the Office of the Deputy Governor, Dr. Emmanuel Lasson, commended the effort of the committee in sensitizing the public on the importance of routine immunization against the child killer and other related diseases.
To assure this gathering that what has been done under this roof will be communicated adequately and clearly. And I believe that being the working governor that he is, he will do something in no distance time, so that by the time we go into the phases you enumerated in September, October, we should begin to see those changes that we are promising.
Dr. Lasson, who chairs the meeting, stressed on the importance of immunization to the health needs of children, reiterating the state government's readiness for continuous support to the healthcare services in the state. He encouraged the committee to strive towards achieving goals as government is committed in investing hugely in the health sector.
On the part of the state government to also increase whatever support that she is thinking of putting into this sector. It's a very, very important sector. It touches on the lives of our people in the grassroots. And you know very well that Taraba being a rural state, more efforts are needed in the area of storage of some of these vaccines, in the area of transportation and communication. But that God on our side, we are going to surmount some of these challenges. And I assure you that His Excellency will get this report as clear as you demonstrated in this discussion.
State Commissioner for Health, Dr. Bodiabuma, represented by the Permanent Secretary, Dr. Shufo Harmony, appreciated government's effort in healthcare services. He added that the Ministry of Health is poised in discharging its responsibilities in healthcare services, among which is the remodeling of healthcare centers across the state.
Your Excellency, the Governor of Taraba State is committed to health. He's doing a lot across the state. Currently, he's upgrading PSCs from level 1 to level 2. About 113 of all these facilities are being upgraded to level 2.
The Executive Secretary to Taraba State Primary Healthcare Development Agency, Dr. Tukuranu Unyigwa, applauded the committee for working hard to meet its mandate, making presentation on performance tracker indicators and action tracker of the agency. Dr. Tukuru analyzed the antenatal and postnatal periods in primary health care facilities and appealed to the state government to uphold its commitment to counterpart funding.
When we have administrative data based on DHIS2, in fact, Taraba State is among the few states that has surpassed the national target. But this one is survey. Why are we behind? If you look at the survey, those people after campaign or they want to do survey, they don't come to the agency to look at our record. They will go to the community. And those parents are interviewed. Sometimes some of those parents may not have the cards that have been given to them. They may not be able to give the appropriate response, and that is what is giving us this low coverage. But as a whole and as a state, we are doing very well.
He stressed the importance of anti- and postnatal clinics to expectant mothers.
We have $1.5 billion grant by the federal government under HOPE. That HOPE is a project that if states, if you do well, there are certain things. They will say, okay, if you do A, B, C, just like the AOP he mentioned about, if you do A, B, C, you have certain amount of money. If you do C, D, E, you have certain amount of money. In fact, a lot of states are keen into get, and it's free money, it's not loan. So there are a lot of opportunities which I will appeal to Your Excellency that the state can leverage on that, even though we've started working on it. There are a lot of challenges we still need support of state government to leverage on those free monies. How we the money should be flowing into Taraba, our economic activity will pick up seriously.
In their submissions, representatives of WHO, UNICEF, security agencies re-echoed the need for collaboration for maximum service delivery.
We are here to ensure that we render the needed support to the state and also to guide the cause of achieving better health indices of the citizens of Taraba State.
In 2023, during the HPV campaign, the state came first. So it is no doubt that with that institution, that in this, we're also going to beat it because we have the capacity.
So from Chigabi Foundation, we work with the traditional leaders to be able to see that since they are the gatekeepers, they can be able to assist the state primary healthcare to be able to address those challenges. So we are ready available and we will support the state primary healthcare for the state to move forward.
Our Nigerian Army are part of Taraba State. We are here for the citizens of Taraba State. We are here to make sure that the lives and the properties of the citizens of Taraba State are well secured.
Kabir Jallow, TV, Taraba News.